Hi, welcome to Miami and our series of patient education videos on topics around total knee replacement or partial knee replacement. This pairs with the book I've written. I'm Dr. David Graybill MD. The book is entitled A Proactive Approach to Knee Replacement. It's available in e-format currently early November on Kindle, Apple, Barnes & Noble, and BookBaby, who is the publisher. This is the third postoperative topic video on the immediate postoperative recovery from knee replacement. I've got a number of videos covering various topics preoperatively. I encourage you to look to those. They're all on this free site. There are also exercise videos on this site specific to elevation, strengthening, range of motion, and other things to either prepare or recover from surgery. So this topic, again, ties in very closely with the last topic, which was the importance of range of motion. Early gains in range of motion after knee replacement are ideal. One of the enemies of knee replacements is swelling. Swelling, I believe, is actually a result of lack of range of motion in many patients. People would come in to see me postoperatively and saying they couldn't get their motion because the knee was swollen. And I would approach this actually a little bit differently. There probably is some truth to that, but I think there's actually more truth to the idea that because they haven't been working hard enough on their motion, the knee is more swollen. So we're going to talk about swelling management here. So moving onwards, here is one of the videos, just a picture from it. The beautiful model here, who happens to be my wife, is demonstrating ideal elevation. Elevation and getting good early range of motion and ice are our techniques to reduce swelling. Swelling occurs in the knee in every patient. There can be a great deal of swelling, sometimes a small amount of swelling, and there's typically swelling below the knee too, down to the ankle. There also late will be some bruising. Those are kind of normal things. Bruising around the incision, bruising in the calf, bruising in the foot. The more we're vertical, the blood loss that's occurred around the knee will move with gravity down the leg, and that always results in some swelling, and most patients have notable bruising. So the point of elevation is the heart is the reference point. So ideal position, laying flat, hip flexed to 90 degrees, knee flexed to 90 degrees, which is a great resting position after surgery, and then you apply ice. That gives us the maximum height of the knee above the heart. So, sitting in a chair. Sitting in a chair is not elevating. Laying flat on a couch, that's neutral. Roughly the knee is the level of the heart. So we may not be dependent. Dependent would be when the knee is below the heart. That's when fluid by gravity accumulates in the leg. Elevation is where fluid through the means of gravity leaves the leg. So above the heart level is the key. So if you're having worsening swelling after knee replacement, what's wrong? Well, some swelling, again, is present for everybody. But if it's getting worse, what that would tell me, if I was looking at you as a patient, is most likely you're spending too much time with the knee below the heart level. So your sit-stand time is probably too much. Another potential problem would be you're not working aggressively in range of motion. When you bend the knee past 90 degrees, you're actually pushing fluid out of the knee and pumping it typically up the leg, which is what we want. when we're leaving the knee less than 90 degrees, that pressure on the tissue isn't there to squeeze the fluids out. Additionally, if you're overactive, your musculature is going to be working, and that brings more fluid into the leg. Lastly, if the whole leg is very, very swollen, there is always a small chance of a blood clot. If this is worsening, you do need to contact your surgeon and let them know. Typically, swelling, if you get in the elevated position on the last slide, will diminish. If it's not, after an extended time there, that can be a danger sign if the swelling is not just in the knee, but it's a lot of it in the lower leg. So be a little careful with that. Blood clots can be serious, can be very serious if they get to the lung, and they shouldn't be ignored. They aren't real frequent. Most people are on a light blood thinner, and if you're pretty mobile and don't sit around, you're up a few times every hour, as I would recommend, moving your knee back and forth, moving your ankle up and down, and staying well hydrated, that fights against blood clots. But just a caution that occasionally swelling isn't from lack of elevation, lack of motion, lack of ice, too much dependency, and not enough elevation. Most of the time it is, but occasionally there are other issues. So, what's the key? Balance. Balance is a key of many parts of life, between, being overactive, recovery, etc. Here, right after surgery, we want to balance enough activity that we're not sedentary. We want to spend most of our day out of bed, most of our day working on range of motion, with maybe a couple of times where we're going to lay down and elevate and isolate. We want to spend a lot of time with ice. I would recommend it every time we're sitting, every time we're laying, ice. And then we're working on range of motion, as discussed in the last topic, every hour for an extended time frame. 10 minutes, maybe an hour working on motion. So we balance that range of motion dependency, sitting, and a little bit of walking here or there with elevation, ice, and compression. So ice can be present almost all the time. Compression can be present pretty much all the time except for showering. And elevation all night and some of the time during the day. If the balance is off, too active, too much dependency, not enough elevation, ice, and compression, we're going to get more swelling. If, on the other hand, we're well balanced, what we're going to see is swelling is not too bad. It certainly is better in the morning after we've been elevating, and doesn't get too much or progress much during the day. That's balance. Pain control will go along with that. If we're out of balance, we'll have more pain. We'll have more swelling. Okay? We're going to lose motion. We're out of balance in that situation. So now compression. Two real techniques. Ace wrap was what I used after surgery. You start at the toes. You wrap from the toes up the leg to well above the knee, to the thigh. Nice thing about ace wraps, fairly easy to apply and remove, although early on you'll need some help with this. You can remove them to shower. Otherwise, I pretty much had them on. They provide enough of a layer on the knee that an ice bag or an ice unit can be applied directly there and doesn't get directly on the skin. Downsides is, as you move around, they tend to wrinkle, migrate, and they need to be reapplied several times a day. They're inexpensive. They can fit any leg. There's no leg too large or too small to apply an ace wrap. If our thigh is more funnel shaped, we're going to struggle a little bit with this, as it'll tend to slide down, but that just means you have to reapply it. The TED compression hose, there are two types. There's knee high and thigh high. We want to compress across the knee, so I would encourage, for most patients, a thigh high, although you could use a knee high and then use the ACE wrap from just below the knee to the thigh if you want to do some mixture. TED hose do need to be sized. There are some people whose legs are large enough they don't work very well. They are more difficult to put on and off, but I think once they're on, they're maybe a little more easy to manage. The ideal time to apply these are after a period of elevation when our swelling is minimal, so they tend to minimize swelling at that point. I would encourage wrapping the leg and TED hose for at least the first several weeks, maybe beyond that. Certainly until we get to the point where we can walk a modest distance and not have a leg swell too much. One downside is they can maybe interfere with extreme flexion or high degrees of flexion. You can always remove the ACE wrap for range of motion exercises, then reapply it. I would encourage you to have a coach or a person around to help you during this time frame. Wrapping the ACE wrap is helpful, and massage sometimes is helpful. A light rubbing from the ankle upwards with the leg elevated can be helpful. Onwards, ice. I got a hotel ice machine photo here. There are many types of ice. I favor ice compression unit. They are a little more expensive. They can be rented or purchased. The nice thing about those is that the ice circulates, the compression occurs, and you don't have to frequently change the ice, and they tend not to leak. So there's a number of advantages to that. But a bag of ice, a large bag of ice, like a gallon bag of ice or more, is also helpful. Ice should be applied often, particularly early. I would describe it as basically 23 hours a day, anytime you're not standing or walking. There are some gel wraps you can even walk with. I used one of those when I was up walking, particularly when I was up for a little longer than just a minute or two here and there. And then the technique how. Number one, ice compression unit, very easy to use at night, harder to use during the day, although if you're sitting in a chair, they can be applied nicely then. If we're using a ice pack, they can be held on with an ACE wrap or some form of Velcro straps so they don't fall off. That's important while sleeping because as you move around, they just kind of fall off. You do want to do multiple bags if you're using ice in a bag to minimize leakage. And the volume of ice should be very high so that it stays cool a long time. If we're using gel packs, they work, but they tend to warm up quickly, so they need to be changed very frequently. So I kind of use those types of things a little later in the recovery after the first couple weeks when I was spending more time on my feet and still wanted to ice. When I went back to the office after surgery, I used those gel devices kind of between patient visits when I was sitting and dictating or between surgeries. So it can be certainly a mix and match combination for people. I don't think there's any right answer. You can get a good result with any type of ice, but use it often, as cold as possible, just not directly on the skin. And for how long to use it, I was still icing at 6 weeks, although not as often. And then after 6 weeks, if I had a day when I was a little more sore, a little more swollen, I would go back and still ice and elevate, then on an intermittent basis. So, kind of summary. Swelling is the enemy of good range of motion. Good range of motion is the key to a less painful and quick recovery, and it's actually the way to gain early activity. Good range of motion is another factor in swelling, aside from ice, compression, and elevation. So don't forget that component. If you're flexing the knee like this gentleman is doing, maybe not the same position, but if you're getting that degree of range of motion in your knee, you are definitely driving out swelling. And that's the kind of range of motion, ideally, we're getting around 2 weeks. Okay? So that's kind of a nice 2-week goal. Well past or way past 90 degrees. He's probably at about 130 degrees, just looking at it by eyeball. We want to be past 120 at 2 weeks for an optimal outcome. So that's my last currently made video on immediate post-op recovery. I encourage you to review the other two, which are pain management and range of motion. We should look at these before and after we have a knee replacement, kind of as a recovery and a guide. There are many pathways to range of motion, ice, elevation, and pain control. There's no one recipe. I intended these, again, to be guidelines. And again, before surgery, there are a number of other topics I posted and many in the book. I'm going to do one late postoperative video at this time. It'll be on kneeling after knee replacement will be the topic. And then at some point in the future, I may post some other videos for informational purposes. Again, I encourage you to look at my book, A Proactive Approach to Knee Replacement. I think it's the most all-encompassing, honest book about knee replacement, on covering preoperative as well as postoperative things, as well as realistic outcomes. I hope you find it helpful, as well as this video series, and have a wonderful day. Thanks again.